Center. I was the original activity director in the first Alzheimer's assisted living facility in the country. I was with the Alzheimer's Association for 14 years and have worked as a consultant for the past several years, but I always say my most important experience is as a caregiver for my grandmother who had vascular dementia. And that's not why I got in the field. I was actually well into it when she developed it. So I kind of realized why I was led to this. Any questions throughout, feel free to ask. But what we're going to focus on tonight is how to have a meaningful visit. And the reason I said meaningful instead of successful is because successful kind of has its own notions about how something should go. But when a person has Alzheimer's or related dementia, we kind of have to redefine what that means. Because as disease progresses, communication changes, the person's ability to engage in things changes, but it doesn't mean we can't still have meaningful interactions. So that's what I'm going to focus on tonight. And I always think it's important to first talk about how the disease affects processing and communication, because that affects how we act and interact with people. If I may ask, if you're caring for somebody with Alzheimer's or related dementia, what dementia is it? Do you have a diagnosis of Alzheimer's, vascular, dementia with Lewy body, just dementia?
Just dementia.
Just dementia. Okay. So if I may, I'm going to use Alzheimer's as the kind of comparison because that's still the most common disease that causes the symptoms of dementia. And dementia in and of itself is actually not the disease. It's the category of symptoms. And symptoms can be caused by neurodegenerative diseases like Alzheimer's or other conditions, which can be depression, medication, urinary tract infection, malnutrition, dehydration, vitamin deficiency. There's lots of physical things that can also cause memory issues. But the reality is often people kind of have a combination of things causing that disease and some of these physical things. So with Alzheimer's in particular, the first part of the brain that tends to be affected is the hippocampus, this little guy right here. And basically that's the gateway through which any new information or what we call short-term memory goes through. If it's important to you, it will store it in your long-term memory so that you can retrieve it later. I said if it's important. If it's not, it stays short-term and goes away. So for us, that's a choice. But when somebody has Alzheimer's, because that's the first part of the brain affected, the hippocampus, basically the gate shuts. So somebody with Alzheimer's can no longer take any new information and commit it to memory, which is why in the early stages and moderate stages, you get a lot of repetitive questions, right? What time is lunch? Lunch is at 12. Oh, super. I can't wait. I'm hungry. Hey, what time is lunch? Lunch is at 12. And it feels like it's frustrating as a family member and a caregiver, but it sounds like it's the first time the person's asking you because in their memory, it is. They cannot retain that you said it's at 12 o'clock. So as disease progresses, the hippocampus has to dig deeper into long-term memory where information is still accessible. So no new learning. As disease progresses, it starts to kind of destroy more recent memories, and it starts to go down into more long-term memories. That's why in a conversation, you may have someone saying, honey, I need to get home because the kids are coming home from school and you're the kids. That's why we see it. People don't just go back into long-term memory though. Past becomes present, but people literally get ripped back and forth between past and present without warning, which is why sometimes when you're talking to the person, they're right with you. And then you come back a little later and they're talking about, you know, I've got to get home. My mother's sick and she doesn't know where I am. So that's why we see that kind of back and forth. Does that make sense? So that's certainly a direct result. The hippocampus plays a crucial role in information storage, retrieval, and processing. And that's why it's kind of important to understand that because that absolutely affects how we can interact with somebody. Second thing is how we think about this. Now, usually when we think of Alzheimer's, and these are the buzzwords, right? Alzheimer's, dementia. When you think of those words, when you hear those words, and I did it myself with my grandmother, we think, I know they're forgetful, but she knows what she's doing. Or he did that on purpose because he knows that drives me crazy. And it makes sense to think that way because you can't see these diseases. In the early and moderate stages, the person looks very much like themselves. In the early stages, the person sounds like themselves because long-term memory is still very intact. And that's somebody's whole life. So when we think of these terms, dementia, Alzheimer's, we're going to call them what they are. So a different way of thinking about it, it's progressive brain damage. These diseases cause progressive brain damage. And the reason I say that is because when you hear the term brain damage, don't you think a little differently? If someone has brain damage, even though we don't always see it, we know that that person doesn't process things the same. And we know that it affects their ability to engage themselves in things they always enjoy. And that's exactly what this is. So if you look at this picture here, the blue, it's kind of hard to see, but the blue denotes the damage to the brain. Early stages, it's minimal. It's right here, so no new learning. Moderate stages, it's starting to affect more of the brain. This is where people can lose the ability to carry a conversation, where they can lose the ability to initiate an interaction, an activity. You have to kind of pull everything out and pull the person into whatever you're doing. It's also where if somebody spoke multiple languages, that person will begin to revert to their native language because it's more deeply ingrained than long-term memory and still very intact. And then end stage, you see where this really is pervaded most areas in the brain. This is often important for us to realize that you hear the term non-communicative, and let me ask you guys, how big a part does communication or language play when you're interacting with the person with memory loss? The biggest part, right? And now I'm going to ask you another question. Of all you communicate on a daily basis, not with a person with memory impairment, just in general, friends, family, coworkers, how much is talking out of 100% of all you communicate? 100%. Everyone agrees? Everybody's sitting down, right? Only about 10% of all we communicate is verbal, is talking. The other 90 is body language, is nonverbal. And think about that, right? When you're facing somebody, or if you're on Zoom, because we just came out of that, right? When you're facing somebody, you're constantly watching what that person's doing. And communication's really a 50-50 interchange. 50% on the person talking to make sure they make sense, but it's also 50% on the people you're talking to. I need to know by what you're showing me that you understand, right? So when a person,
if someone's non-communicative,
yes,
can they understand you?
Excellent question.
Understand what you're saying.
It depends, but 9 times out of 10, yes, especially in the early and moderate stages. So that's the word, communicative. It's not so much communicative because communication happens even when the words are gone because 90% is body language. Non-verbal, watch the person. You can literally tell by watching a person if they're understanding, if they're trying to figure out what you said, if they have no idea what you're talking about, or if they're on to the next thing. So what I promise you is that throughout the progression of these diseases, the person shows us everything we need to know. But being aware of your perception of communication becomes imperative. Because if we think 100% of all we communicate is the talking piece, and then the person's no longer verbal, or you have to pull out the words, that's when we think there's a break in communication. But folks in these diseases also develop an exceptionally keen awareness of environment and body language, and literally read you faster than you open your mouth to talk. Even to translate that to behaviors we may see when we're visiting or interacting. 9 times out of 10, behaviors are a direct result of something the person is reading in the environment. So whether it's what we're showing or something else going on, it's a reaction to that. Yes.
Someone who's trying to talk to you, who was really good at that, all of a sudden start saying 2 words and then never mind. What stage would that be?
Interesting question. So here's what I always say. You hear 2 different ways that disease progression is described. Stage 1 through 7, which I say, please don't pay attention to because you can't stick someone into such a specific stage, or early, moderate, and late. And in terms of just the communication piece, when you try to determine where somebody is in the disease process, you really want to look at everything. So it's not just communication, it's is that person still participating in personal care? And by that, I mean, if I hand the person a toothbrush and then they can brush their teeth. You want to look at overall functioning in all these areas to determine stage. So you can have people relatively early who are losing the ability to verbally communicate, but they're still understanding everything going on and reacting. And sometimes, and that's why I say you want to watch the person. Sometimes people get frustrated with themselves or feel pressure that we don't even realize is happening to get it out. And if they can't get it out, just never mind. So sometimes every situation is different. The most important thing I want to impart is there's no right answer and there's no right, it's try it. If it doesn't work, take a deep breath and try something else, because our advantage is the person will forget. And then we can reapproach it. But sometimes saying, take your time. Or if the person seems like it's okay with them, if you're trying to give the person the word, or show me what you need. Sometimes that can make the difference, or write it down. Sometimes note therapy is more effective than getting out the words, because the brain just works in different ways like that. But you can't really tell. You want to look at everything that she does to know where she is. Does that make sense? I always say though, because you never know when moments of awareness are going to come or go, you want to always act like you're in it. So always assume that the person understands. That's kind of our start point. Any other questions about this?
At some point, I didn't know this was Alzheimer's specific.
What's any neurodegenerative disease that causes dementia?
Just let me know when it's appropriate.
Go ahead.
To put specific questions, situational questions. Because I got some along in there.
If this prompted it, then ask it. That's what we're here for. Okay, so maybe if we don't get to it, you bring it in. You're very welcome. So in terms of communication, what people start to lose is receptive language, which is basically how you understand written or spoken words. So as diseases progress, as brain damage progresses, the words lose meaning. And if you look at how we understand language, it actually is processed in different parts of the brain. So reading words is processed back here. Hearing words is processed right here. Thinking words and saying words. So it all is processed in different parts of the brain. And if you think back to that slide before, oh no, never mind, I had it right there. See, I don't even listen to myself. This shows the damage. So early stage, usually communication is relatively unaffected, unless somebody has what's called aphasia. There's receptive aphasia, where the person doesn't understand the words being said, and there's expressive aphasia, where the person knows what they want to say, but they can't get it out. So aphasia can be a part of some of these diseases. It's not always, but it can happen.
Is this damage, brain change pattern specific to Alzheimer's? Or is that also?
This is depicting Alzheimer's because that's the most common. Is there a particular dementia that you're?
There's not a diagnosis, there's just symptoms.
Okay. So
Kind of related to a question I had is,
okay.
how do you diagnose Alzheimer's versus some other type of?
That's an excellent.
That is dementia, but I don't know.
That's a great question. And let me tell you, they can be 90 to 95% accurate in diagnosing the cause of the symptoms of dementia. So the first most important thing to know is dementia is not a disease. Dementia is just the group of symptoms. We want to know what's causing them. And basically what they do, what's advocated, is a comprehensive assessment where they do a series of evaluations. So it's not just a cognitive test in an office. It's cognitive tests, it's blood work, it's a physical, it's an MRI, it's a PET scan, it's social history, medical history, whereby they effectively look at the whole person and they can rule out physical causes like medication interactions, depression, metabolic disorders like thyroid, kidney, or liver that can cause memory issues. And they can more specifically hone in, if it is a disease, which one it may be. So it's a comprehensive geriatric assessment with
If the father's approaching 96.
You can, it doesn't necessarily, no.
Exactly.
But it's a question, you know, in all honesty, and not to be morbid, that may be something where, when his journey ends, you might wanna have his brain biopsy to see what it was, because that can make a difference for future.
But it doesn't necessarily make a difference.
If you see it progressing, then no. And basically, communication techniques are universal. So whether somebody has progressive brain damage, or it's just somebody who doesn't have it, really still 90% of all we communicate is nonverbal. So that's what's important to remember. So does that kind of answer a little bit? Yeah, if someone's that age, then you don't want to put them through it. No, yeah, just
Depending on what type of dementia, does that affect how it's treated or?
good
how
question.
to Approach.
The
it,
treatment
or-
is the same. We just now, they have, on an emergency basis, approved the first drug that actually is meant to slow the progression of these diseases. All the other drugs to date were meant to delay the presentation of symptoms. So basically, it means they're meant to delay what you see, but they're not slowing the disease down. It's still progressing. So just now, they've introduced the first drug that actually can affect the trajectory of the diseases. In terms of approach, it can sometimes make a difference. So there's a dementia called frontal lobe dementia. There's different diseases that fall under that. Frontotemporal dementias have a lot more challenging behaviors associated with them. And they also can affect people's ability to act appropriately. You may see outbursts, you may see very inappropriate behaviors, inappropriate sexual behaviors, and there's not a lot you can do about that. The biggest challenge with frontotemporal is there's no warnings. When you look at Alzheimer's, vascular, which is caused by mini strokes, Lewy body dementia, which looks like Parkinson's and Alzheimer's simultaneously, so you have physical effects. You tend to see behaviors before they happen. It's just becoming aware of it. You can tell when someone's getting agitated, and often by adapting the environment, which means how we approach or when we visit, you can calm the behavior or get through it. So in that sense, a little bit, but it's all the same premise. We all want to watch the person. That's the key. Okay. So in terms of the damage, as we said, you can see as diseases progress, with Alzheimer's in particular, hippocampus first, more damage is pervading more areas of receptive language. And then end stage, again, communication doesn't cease unless the person's in a coma. That person still is benefiting from receiving communication, and communication can be touch. It can be just being, it can be reading aloud from a book that the person loves. That's still making that connection. Okay. So that's why I want to say, get non-communicative out of your vocabulary. There's no such thing unless the person's in a coma. Non-verbal, yes, but communication still happens. And you tend to, from the moderate stage on, really 100% of all accurate communication is nonverbal, is behavior. Good and bad and indifferent, but that's the true communication.
Is much of this hereditary?
That's a good question. So in terms of Alzheimer's in particular, there are two types. There is late onset, which is the most common. That affects people 65 and over. Age is the single greatest risk factor. So by 65, about 1 in 8 people develop it. By 85, about 1 in 2. It doesn't mean we're all going to get it, but that's just statistically. Heredity plays a role. If you've had a parent or a sibling with Alzheimer's, you have a greater risk of developing it, but it's not deterministic. It doesn't mean you will. What does seem to be hereditary is young onset. And there's one in particular that affects people in their 30s, 40s, and 50s. And they've actually identified a gene, presenilin 1. If somebody has that gene, it is deterministic that they will develop young onset Alzheimer's. And then there's a 50 to 60-year-old version, presenilin 2. They've also identified the gene that doesn't seem to have as strong of a hereditary link. But if somebody has that gene, they will develop young onset Alzheimer's. Other ones like Huntington's disease, which is a frontotemporal dementia, is 100% genetic, 100% hereditary. Those
frontal lobe, I'm sorry,
That's okay.
he had aphasia. We called it progressive aphasia.
Okay.
He eventually succumbed. At the end, he couldn't find the word, didn't know totally else the word.
Yeah.
That was what.
Okay.
Is that kind of thing passed from siblings?
Does she have similar characteristics to that?
I see her more right now. With the frontal lobe dementia. It seems like outbursts and not being able to hit the cane with a ball, it becomes a real issue.
So I guess the thing to think about, in all honesty, is, first of all, even if she does have what her brother had, no two people go through it alike. It affects the person as unique and individual as they are. So right now, I think just focus on her moments. Don't think that this is what he went through, so you're gonna go through that next, because everybody goes through it differently. What we do know is it is progressive and degenerative. Okay. Good questions, though. So changes you see as any disease tends to progress. You see changes in judgment. And again, it's progressive brain damage. So people don't judge the environment. They don't process it appropriately. You can see that in how somebody dresses. Maybe somebody's wearing, a parka in the house and it's 90 degrees, because your brain controls your temperature. So when that part of the brain's damaged, people can misperceive. You see safety awareness often goes by the wayside. And again, that's that lack of judgment. Orientation to time and place. If someone has no short-term memory, they're not going to hold on to time. Where does that come into play when you visit? If someone's in a care setting or even at home, and you say, I'm just going to go out for an hour and I'll be back, and you go out for 58 minutes, and you come back and the person goes, where were you? I had no idea where. I told you I'd be back in an hour. It's been hours, and I had no idea where you were, because that person doesn't remember that you said that. So orientation to time and place doesn't really have any place in connecting with a person with a dementia, right? Behavior changes, but I want us to focus on the positive aspect of this, because behavior is communication. It's how the person communicates. You can tell by watching the person what's going on. Physical ability changes as disease progresses, and usually for the majority of diseases, that's later stages. Spares physical health to the later stages, but your brain controls every function of your body. So as disease progresses, it can affect a person's ability to walk, to feed themselves, to do the activities of daily living that they always did. Okay. And senses can be affected: sight, sound, taste, touch, and smell. So a way to see that is sometimes a person will take a hot cup of coffee and drink it like it's ice water, not perceiving that it's scalding hot. So I promise you there's bright spots to this, but this certainly affects when we interact with the person. So it's important to kind of know what the changes can be. Communication pitfalls when we're visiting or interacting with a person with a memory impairment. Arguing with the person or trying to explain things typically doesn't go well. Am I right? Okay. And I always say we actually have unique insight here, because we know what it feels like for moments to have these diseases, believe it or not. And I'll give you examples. Have you ever lost your keys? I'm not giving diagnoses. Have you ever walked in the room and you can't remember why? Okay. See? But if it's consistent, then that's normal for you. Right.
So my mother can recall things from 1941, 1942, but should we not ask her? Like, I'll ask her questions about that. And then when she doesn't know, you can see the frustration in her face. But like, she was talking with her cousin, and it was like they were right there.
Yeah.
I don't know whether it's good to ask her those questions.
Actually, I think you just answered your own question. If she's engaged in it in the moment, it's the right thing. If she gets frustrated, move to something else. She's going to show you. That's the key. But think about when you lose your keys, when you forget why you walked in the room, how frustrating it is. when you're looking for something and you can't find it. We see that in folks with these diseases. When you run into someone you hadn't seen in a long time and you don't recognize them, but they're saying, it's so great to see you, and oh, we should get together. And you're like, who are you and why do you know so much? The feelings are exactly the same as when a person with a dementia doesn't recognize in the moment their adult child or their spouse. The feeling is the same. So by knowing what it feels like, you can recognize it in the person and help them through that moment. So that's, believe it or not, an advantage that we don't have with a lot of other diseases. So when you're interacting, as I keep saying, they are our greatest guide. Nobody can pretend to stand here and tell you what's always going to work. Only the person you're interacting with can do that. That's the key. And there's no
If
wrong.
someone doesn't recognize someone, but they recognize them,
Mhm.
they do, but they don't.
Yep.
You should help them.
It depends, try it. If the person gets frustrated or upset, then we switch to something else. If it seems to calm the person or they're thankful for it, and you can tell by watching someone, then it's the right thing. Don't get hung up on what should I do or shouldn't I do. Only the person you're interacting with can show you that. And it may be different every time you're doing it, right? One thing may work today, may not work tomorrow, may work next Tuesday. So you always have to have a bag of tricks. That's the key. You know, but she'll show you.
So speaking of tricks, so here's my numbers on this project. We're trying to explain to much. I have a hard time seeing sort of perseverative cognition, you know what I'm talking about?
Yeah, to get stuck on something. It's stuck. in-
Worrying yourself to death over
Correct.
everything. So you don't want to explain too much. You're trying to relay the fears, strategies, suggestions.
Well, always focus on the emotion and not the words that the person's using. So if you can give me an example of what the person's anxiety is or their perseveration.
Why are you here?
Okay, what,
What's wrong?
and is that when you visit?
Yeah.
Okay, well, so what is she in a care setting? Okay, so here's the thing. One thing to do is talk to the staff, in all honesty. And maybe it's a point of don't come where you have a one-on-one visit right now. Come at a mealtime or come.
It's a little different.
But those are the things you want to look at. If they always get stuck when it's one-on-one. Oh, I didn't realize that. Forgive me. That's okay. So, but still get a sense of the best time of day if you're here to visit for a little bit. Come in with a meal and sit down with a group of people and how to go.
Good.
He answered your
So,
question.
He will go out tomorrow? No.
You don't know,
He says no.
but he says that and he's got memory impairment. So is he gonna remember he said that tomorrow,
That's a good point.
right?
Okay, good.
Every day is different, every visit is different. That's the
So,
key.
then my video on raise your voice, but you never said it.
Yeah. Well, ideally, if someone's hard of hearing, you actually want to get close to them. You want to drop your voice and speak in a clear, direct tone. Women tend to have more of a challenge than men because our voice tends to blend in with background noise. But that's what you want to do is drop your voice a little. And if you can't hear, it's okay. I think we've probably got a lot of that going on. Well, I'm trying to be delicate, but that's the norm. The key is you don't want to give a perception that you're yelling. So be mindful of your face when you do it. That's the key because you can reach.
Yeah, well, that's a lot of video.
Yeah, I understand. Trust me, I understand. So arguing with a person and trying to explain is for our reality, and they're getting ripped back and forth between past and present. So the best thing you can do is start with where the person is. If the person's verbal and they're saying, I've got to get to church, start there. Oh yeah, I don't think we need to go for a little while. You don't have to say it's not a church day. Because wherever they are in their long-term memory, that's where they are. So that's where we start. You want to be careful about talking to the person as if he or she were a child. That's why I keep saying that. You never know when moments of awareness are going to come or go. So you always want to be in the moment of awareness, respect, dignity as an adult. Because the biggest challenge with all these diseases is long-term memory is intact the longest. That's why people can talk about 40 years ago like it was yesterday because they're there. It's not remembering, they are reliving. That's an important distinction. And people can relive great events and not so great events. But in terms of that, think about how many years of this person's life they've been an adult. And people know when they're being talked down to. So ideally, we always want to make sure that we're treating that person as an adult. A raised tone of voice, I understand it. We all do it, trust me, even me. But ideally, you want to try to drop your voice if you can, be close to the person. If there's a better ear than the other, oftentimes the person will lean in with their better ear. That's the one you want to talk to. Try not to ask too many questions that require specific facts. We don't even realize we do this. And again, we all do this. Like, do you remember what? Well, no, I've got progressive brain damage. If you know it, first of all, say it up front. You know, I understand your daughter Betty was here yesterday. That's so great. It's so nice to catch up. Instead of, was your daughter Betty here? Because guess what? No, she hasn't been here for months. So we want to try not to ask too many questions, one thing at a time, watch the person, allow time response.
Just forgot. So,
That's right.
so say, no, wait, I remember.
This is the room for it.
So if they say, oh, Michael hasn't been to see me in months.
Yep.
I would say, yes, he was here yesterday. Look, here's a picture.
But that.
Is that okay?
I don't know. Have you done it?
Yeah.
Yeah,
And how did she react?
yeah, exactly. Yeah.
Okay.
Well, then that was the
But-
right thing.
But she's
But, well,
blowing
she
it off.
says that though, is it possible subconsciously? Because sometimes I think she knows that's like, crap, I'm not remembering. You just see the look on her face.
Well, then,
Don't do that.
no, then adapt it. Right? And maybe think of a way to say it so it's like we all do. When I can't remember somebody's name, I'll go my husband, introduce yourself, and then they'll say their name. So it's playing around with the right response. If she doesn't get upset, I think it's okay. But if you sense that that's, oh my God, I can't believe I forgot. Then just make it, try it in conversation. I'm so glad Michael was here with you yesterday. He sent this great picture.
Sure.
Something like that. There's no right word, just know that, but she's your guide. She's your guide, and never beat yourself up, because in time, the person won't remember that exchange. It's true, but the key is if you wear it and you're upset by it, that's what the person reacts to. So be aware of what you show. Try not to talk about the person as though they are not there. And frankly, you see this more with doctors. Or if it's a holiday and people come to visit and they're looking right at the person with memory impairment and talking, well, she looks great. She really, and she's right there. So if the person shouldn't hear something, then they shouldn't be in the room. But if they're in the room, then you want to make sure, even if the person isn't as verbal, to pull them right into the conversation. Because people know when they're being talked about. And you can see it in reactions. You can see people begin to isolate or kind of pull back. So we always want to make sure we're engaging in the conversation, even if they can't verbally connect. Yes, sir.
If they're in a different world in their mind, if they have some story made up.
Yep.
Is it okay to go like, I'll just go along with the story and if he's concerned about something, I'll say, we'll take care of it, don't worry about it, everything, I'll take care of it. And again, just reading their body language and how they respond. So.
Yeah, and that's actually what we advise people. Back in the day, we used to teach people to do reality orientation. So if somebody has a story in their head and it's completely off, you correct them and you explain why it's wrong. And I'm Irish, and when people do that to me and I know I'm wrong, I actually get more right. So, right, that doesn't change with the disease. Whatever the person says is where they are. So that's exactly what you want to do. Follow the person's lead. And if it's something distressful, you want to allay fears by generally addressing things. Don't be specific though. You know, I'll go to his house tonight because in moments of awareness, a person may call you on it.
Yeah.
But that's exactly what you want.
He's very concerned that he has to be something.
Well,
I'll take care of that.
yeah, but think about that, right? He's 90 or in his 90s. That's very much a part of his generation, especially for a gentleman. You take care of the finances, so it makes sense. And that's the perfect thing. Allay his concerns about it. Oh my gosh, no, I took care of that, or you know, no problem. But that's exactly what you want to do, and it makes sense, right? Because that's what he did.
And is there any way to teach your spouse to underlying senses of fear that not only is this taken care of, but we take care of stuff. You don't have to worry all the time.
Nope, because that's new learning, right? So it's validating it every time he says it. I know, but once you start to do that, you'll see it's easier,
Yeah, no,
you know, because it's 9 times out of 10, it's our hang up. Right, we need to base them here, we need them to stop asking, because I'm taking care of it, you can't teach somebody with progressive brain damage.
want to stop lying for his own.
The thing,
Do it.
but the thing you want to ask is, and ask the staff while you're here, is he worrying 24/7? Is it affecting his ability to engage in other things? And if it's not, then people worry at times, as long as it's not consuming him. That's human nature, right? That's the key. Yeah, but ask the staff, because they'll know. You have 3 shifts of people, so they see 3 different sides of him. If it's consuming him, he can't eat, he can't engage in things, then that's a problem. Well, and also you could be long-term memory, so sometimes it's a magnet. I'm not saying don't visit, I'm just saying sometimes that happens, like if you have someone who is an elopement risk, they always want to leave. If we have that person next to a window looking out on a parking lot or a road, we're drawing them to it. But if we have them in an environment where they don't see those things as constant magnets, then you don't see the behavior as much. So that's the stuff you want to look at, environment. In terms of how we interact, there's also a big thing, and this kind of goes part and parcel with that. The person with progressive brain damage cannot adapt. They can't adapt to any environment. They can't even adapt, honestly, to home. As disease progresses, it takes away the person's ability. What that means is that now we have to adapt the environment to the person. And environment is 3 things. It's the physical space. It's how we engage the person, because they can't engage themselves. So when you think about a visit, don't say, what do you want to do? We need to come in with it and pull them into it, if that makes sense. And it's how we support the person. So wherever the person is in their long-term memory, if they're worried about something, we want to acknowledge it. You have to acknowledge it and then try to move away from it so that the person doesn't perseverate on it. And sometimes it's a loop. You get out and then you go right back in, and then you get out and you go right back in. But that's been an active visit, right? So that's important to know. Create opportunities. Sometimes we wonder, what can I do on a visit? You know, because it gets hard when the person can't tell us. So ideally, I want to take away from activity and focus on interaction, because it's about interaction, how we interact with the person, how we engage. And you can walk from a person's apartment to the dining room and engage in everything that's on the wall and the people that pass by. That's an interaction. That's a meaningful interaction. As you're walking down the hallway, isn't this a beautiful picture? I remember we had gardens, and you can say, I remember. Look out the window. It's such a beautiful day. I can't wait for fall when the colors start to change. But you can engage people in things all around us. You don't have to fret about, what do I do? And also just knowing the person. What did the person always enjoy? And while they may not be able to initiate that anymore, we can still bring in factors of it. So if someone used to love playing tennis, maybe obviously they can't play tennis anymore, we can talk about tennis, we can watch tennis, we can look at photo books of tennis and still engage in that activity, and it still is meaningful. Does that make sense? Mm-hmm. So don't stress about it. And let me tell you, music is probably one of our greatest tools. Music is processed all over the brain, so it pervades areas of damage. And oftentimes, not always with aphasia, but you may see it, even through the verbal difficulties, often a person can still sing or interact with music. The key is it has to be meaningful and familiar to that person's past. Music is a great tool. Listening to music or anything rhythmic, whether it's reciting a prayer, whether it's poetry. These can be wonderful interactions. The person may not have a conversation with you anymore, but if they loved Halloween's coming and I love this, Edgar Allan Poe. Bring in the book and just read some of it and you can watch the person engaged in it. That becomes a meaningful interaction. Take time to be outside in good weather. It's weird weather. You have to temper that, but being outside, we know for us and for anybody, just physics. Being in the sunlight, it gets your endorphins going, so it just makes people feel better. So just even sitting outside for a visit, not saying anything, just letting everything around you. Go ahead. Sometimes you play around with how you ask. Do you want to go outside? No. Come with me, or take my arm and just start walking. Sometimes when we say it, there can be lots of things going on. Receptive language, the person may not understand what you're asking. Typically, we compensate by showing what we mean. So try some different things without asking, because if we ask, you're most likely going to get a no. Right? But if you just come on, or, oh, I've got some coffee, you may, and then maybe it's not the time. Maybe you just sit down where you are. I understand, but remember, it's the meaning is in being. The meaning is in being. So wherever you are, whether it's outside or sitting, you know, wherever, you're having a meaningful interaction. I promise. I know it doesn't feel like it, but I promise. So what you can do on a visit, maintain a personal connection. Maybe it's just, as I said, just being with the person. Maybe it's watching something or coming during an activity if that's possible and sitting next to the person because you get the benefit of social graces. Coming for a meal, just being with the person. Engage the senses, sight, sound, taste, touch, and smell. There's all kinds of great ways to engage in those things. If you bring in scented hand cream and give the person, men or women, a hand massage with the scented cream, or no, the person doesn't have to be in a setting. That's a wonderful interaction because you can't put words to touch, right? Or a manicure. If you bring in something the person loves, cookies or pumpkin spice latte, I love those. But the aromas also unlock memories. We store and retrieve information through all of our senses, and that isn't destroyed by the disease. Senses decline, but certain senses still remain intact. So those are also meaningful visits, you know, making something the person loves or loved, or using a favorite recipe they had, hand massage, anything that stimulates the senses can be a great way to interact. Use the power of music. I can't say it enough. It's the greatest tool. Provide comfort through your voice. When people are hard of hearing, that can be a little challenging. But your voice can really provide a sense of safety, of comfort, of familiarity. And familiarity isn't familiar. Familiar means I recognize this. Familiarity is a feeling, and it's a feeling we can create. And think about it in this way. If you've ever gone someplace you've never been, you can't get out fast enough because it just is not a good place. Or you go someplace you've never been and you feel right at home. That's familiarity. That's a created feeling. So those are things we can do too. And your voice can really set moods and tones and comfort people. When I used to do activities, I often either made people fall asleep or cry. So your voice is very powerful. Just reading something aloud or just talking, even if the person isn't talking back, doesn't mean the communication isn't still happening. Okay. More ideas for things to do. Looking through old photographs. You don't even have to use words. Old photographs are better because it's more ingrained in long-term memory. More recent pictures of folks or grandchildren may not be recognizable. And frankly, they don't even have to be family photographs. You can create a photo album that's a theme. Maybe someone always traveled. So you can have a photo album of different places they went. And it can be something that in the creating of that album, whether it's cutting out pictures or putting pictures in an album, that's a meaningful visit, an activity. And then it becomes something you can bring out each time. So that can be a great way to have a visit. a manicure and massage, taking a walk on a nice day, creating a memory box. This can be just a shoebox. Decorate it with things that are either textured, because that's a sense you can touch, right? Or colors, whatever the person likes. And within the box, put meaningful items. If somebody is religious, put in something from that person's religion, whether it's a rosary or a book. Have music. I used to say CD, but I don't think you have CD players anymore. But if there's music, that you have on a little something you can play, then that can be a great thing to have in the box. Have scents. If someone was a wonderful cook, have different spices in there that you can open up and smell. So again, the interactions in creating that memory box, and it's also something that can be pulled out. Yes.
How would you explain this? Like, my mother the other day said, how many sons do I have? Yet 5 minutes later, we showed her a picture and she knew everyone's name. How she can't go back and remember who her children are, but if you show her a picture, she knows who her children are.
I can't explain how the brain works. However, was it an old picture or a recent picture?
15, 20 years?
So maybe the picture was more recognizable, but the picture is also something concrete. It's in front of her.
Right, as opposed to.
But when you're talking about recall, because a person gets ripped back and forth between past and present, it's hard to pull very specific information. Because, today she's at a point where doesn't even have children yet, or she's only got 2 children. So it kind of gives us a sense too, when somebody asks a question like that, where they might be at that moment. But the picture is concrete, it's in front of them. And it's the same premise as, instead of asking, did your son visit,
Right.
say it. Because she can't pull that. Does that make sense? Oh, I talked about those. Bring in a meal too, a picnic meal. Yes, sir.
I have a question. So, my dad, and I asked a lot about his wife, who passed away quite a while ago.
Okay.
So he asked, how she's feeling and things like that. And I just say, oh, she's doing fine. I mean, is there any advice to how to address that particular question?
First of all, let me say, I think you're addressing it well. Ideally, when somebody asks a question like that, what it does tell us is that, 1, wherever they are in their long-term memory, she's still alive. And 2, she's on his mind. So you always want to validate feelings and address that, right? Some people think you should say she died, but 9 times out of 10, if they were there in that moment, then it's going to say, oh my God, I can't believe I forgot she died, and rip someone's heart out. Or they're going to relive it like it just happened, and they're going to forget. We're going to keep doing that. You never want to do it. So what we say is give a therapeutic explanation. Therapeutic explanation is the truth, but not the whole truth. She is fine because she's not suffering, right? So that's the right thing. And that's what you want to focus on, therapeutic explanations. Reality is our sense. This person's getting ripped back and forth.
There's been many times I go in, the first thing is just say hello and say, and did so-and-so die? Did so-and-so die? Did I go to the funeral?
Well, she's asking, answer it. Because it's on her mind and she may be in a moment of awareness. And see how she reacts. See what I mean?
Sometimes she breaks down.
Okay.
and sometimes she doesn't.
So if she doesn't, how, does she break down more than she doesn't break down?
50-50.
50-50.
But I also think it's how you respond to the question. So she has a picture of she and her husband, probably was that an engagement picture or on that wedding picture. And
50 years ago.
she pointed to the picture, it's right by her bedside. And she said, is that my husband? And I said, yes, it is. And she asked me to bring over the picture. And she said, is he dead? And I said, yes, he is. And then she burst crying and she said, I never got to say goodbye to him. Well, he's been gone for 48 years, 50 years. But I quickly turned it around and said, look at that hottie in that picture.
That good. And did that work?
Yes.
Okay. So you're answering your own questions because you're following her lead.
Yeah,
Ideally, you want to acknowledge the feeling, right? So obviously that was on her mind. If you passed that long ago, that's probably something that's been with her for a long time, that she never, whatever, got to say goodbye. So you need to acknowledge that. And sometimes even saying, I know that must be hard, but look at that item, right? Or start to talk about things familiar to the past around that. You guys met in college, didn't you? Married your college sweetheart. And you can actually turn it into an opportunity to reminisce. It's not always beautiful, but it is important to validate the feeling. So obviously he was on her mind. Another thing to watch for, if an item or a picture is always upsetting, remove it. But if that's not the case, these are moments that are important. Even people with progressive brain damage go through life review. So you always want to be there in that moment and support it and then move them on because they can't necessarily get out of it. That's the key. She's absolutely your guide. And again, even if it goes wrong and she cries, she will forget. So you have a 50-50 shot each time that happens, right? But she'll move out of it. We just kind of carry her through it.
well, and the good and bad thing is, I think whoever's visiting her, like her poor daughter, I think gets the brunt. Because she told her what to do so much her whole life.
Yeah, long-term memories.
So, right, so
That doesn't go away, the guilt button.
whereas when her son comes to visit, our job is to make her laugh. And, he's always the butt of the joke. So it's just how the family dynamic is.
Absolutely, 100%.
And so how do you try and turn that around for her?
You're not gonna change her.
We're not gonna change
She's,
her.
that's the thing. One thing we want to kind of move away from
Yeah.
is we feel like it is our responsibility, our job to guide her, right? Because she has progressive brain damage, she can't guide herself. The reality is she's our guide. You just follow the lead. And know that every interaction is very much in the moment of the interaction, not before, not after. So also what I'd advise is when you have a particularly tough visit, go do something nice for yourself. I'm not kidding, because you guys are the most important people in the scenario, not the person with the disease, period. They've got you. You're overseeing care, whether they're at home or in a setting, you're still overseeing care. But if you don't take care of yourself, you can't oversee the care of that person, period. You can't. You're the most important person. So honestly, also, if you're having a tough day, you don't have to visit. Because the meaning is in the moment you're visiting, not before, not after. There's no concept of time. So if you're having a tough day, don't visit. Do something nice for yourself and then come when you're ready for it. Let yourself off the hook.
I have a family that I work with. I'm gonna get emotional. My heart breaks with the daughter, but the mother is so unkind. And the daughter comes out of course, love and compassion. I'm sure also a sense of obligation. And it breaks my heart because I want to say to her, let yourself off the hook. Because the relationship that it existed, however, many years ago, is not the same. And I would be hard pressed to find something positive truly that came from the visit in the stage that the mom is in now. It may change, but right now it is brutal.
Yeah.
And it breaks my heart. And it's not my place to say, don't come. I can offer that, it's okay if you choose to come less often or whatever, but it hurts so bad to watch because no matter what she does, it's never a positive experience.
Well, and other things to try in that sense too, or to suggest is have whoever work with her, and it might be you if you've got a close relationship. And what's the best time of day?
Yeah.
Don't come for a one-on-one visit, come during a meal or an activity that she loves, like music or whatever.
Yeah.
But come where you're gonna get the benefit of social graces, because it's usually the one-on-one visits where people get their back up.
Absolutely. That's a great suggestion.
So I would, because if she may have a need to come.
Yeah,
but there are ways we can temper it.
right,
Or say, when you wanna leave, I'm gonna come in 5 minutes before and start to break it off.
yeah,
And it will change.
yeah,
It'll change as she progresses.
it's hard to think, for her, it's hard to think that far ahead.
You can't, you gotta think in the moment, but those are some things to suggest maybe,
And her other siblings, have positive experiences.
which
so-
makes it worse.
Yeah.
Yeah. Yeah, but that's like to me, and it's terrible, but it says, my mom didn't raise a fool, and if she did, it's my brother. But yeah, and humor is an important thing, humor helps. So, all good thoughts. Other things we can do, when you're a distance away, if possible, virtual visiting. You could set it up with staff.
We'll talk about those.
Well, and again, every visit's gonna be different. And the disease is gonna progress, so what's bad now isn't gonna be later. But that's also when you miss it. In all honesty. But virtual visits, we did learn during the pandemic that is something we can do. And if someone's at home, you can set up a weekly, virtual visit with other family members or friends, because if it's hard for folks to get out. If you have to be there to monitor and help the person with it, that's fine. Short and sweet. Phone calls get difficult because it's a disconnected voice. And the person can lose attention to it. So virtual visits can be a great thing to do. There's also other things. If you've got an iPad, I say something bigger. Phones, sometimes if the person's vision's pretty good, but something bigger can be helpful. That can be a great visit. If there's nothing to say, and I'll give an example of my husband's uncle who had Alzheimer's. He loved steamer ships. So whenever I would visit him, I took my iPad and I just Googled the images of steamer ships and we just look at the ships. And believe it or not, it was always a great visit because he was happy because long-term memory, he always had an interest in them. And occasionally he could tell me about the different ships. So it can also be a great tool for a visit to just look at different, and that's the beauty of Google. You can look up anything and say images and then just have that to look through like a photo album. Other things, when you have a virtual visit, you want to reflect on things. So start the conversation. Sometimes have an idea of what you want to have the theme of the conversation be, because it may not necessarily be two-way. So maybe it is just you talking and there's somebody else there to help with the visit. Plan something together. Like, I'm going to cook dinner for, 10 people. So I know when you make dinner, you always start with an appetizer. So what should we do for an appetizer? So even talking through something that seems mundane like that, this is very much a part of people's lives and something they always may have done. So it can be, believe it or not, a great conversation. And then bring it in or bring it to the person after you've made it and say, be my taste tester. What do you think? And sometimes you're amazed at what comes out of those things. Anything is an opportunity for an interaction. Tell a joke. The beauty is you can tell the same joke.
And you're funny all the time.
Right. And if you need help, Reader's Digest, I think, is still around. But Reader's Digest always had a section in it called Laughter is the Best Medicine. Just reading those is a great interaction. When I used to do activities back in the day, I would actually always start with those. And they were hysterical. Even I still giggle at them. Share a virtual experience. During the pandemic, a lot of places stepped up to the plate and they're still around. There's gardening classes. There's virtual tours of gardens, tours of museums all over the world. You can access virtually and there's no cost. So looking into that to see about someone was always a gardener or always, loved to travel. You can do virtual visits to places all over the world. You can go to the zoo virtually. All the fun without the smell. So there's lots of things we can do virtually. And then sometimes the meaning is just in being with the person. It isn't always about a conversation or actually doing something. Sometimes just sitting with a person. Sometimes just, as we said, giving a hand massage or a manicure, or brushing somebody's hair, or helping them dress the way they always did. If somebody always wore makeup, then make sure we have the lipstick on and the perfume. That's what they always did. If somebody always wore a coat and tie when they left the house, then let's make sure we have the coat and tie on. Is it important? Do they need to? Yes, because if that's part of what they always did, people still feel that. It makes us feel better because part of it's how we identify ourselves. So even little things like that, and if you think about those things, it also stimulates the senses, right? So if you've got aftershave or perfume or lipstick, it stimulates the senses and unlocks those memories. It's okay to sit in silence. It's okay to just sit next to the person while you're watching a movie. You don't have to have a conversation. That's not the biggest piece of an interaction. Is people sense the presence. And that can be just as meaningful as the things we used to be able to do when the person was still living. You know? When to visit. If someone's in a care setting, gain a sense for that person's best time of day. All through these diseases, people develop, and it changes, a normal pattern of confusion to their day. So maybe somebody is always more clear and better in the morning to the afternoon, but after lunch, they start getting more confused and more agitated. So ideally, dinner time isn't the best time to visit. And it's never, ever about the frequency and intensity of visits. The meaning is in the moment you're there. So if it's 5 minutes on your way home from work to bring ice cream, that's a meaningful visit. That's all it has to be. There's no time frame. No one judges, well, she was only here for 5 minutes.
No, so.
But you can work with yourself on that, right? The person with the disease can't. But that's, coming here tonight was a huge step, honestly. Because this, let's be honest, this sucks. It wasn't supposed to be like this. And it wasn't supposed to be this difficult. And the hardest thing when it's your family is that even though you understand that this is disease, it doesn't matter because your heart jumps in front of your brain. I did it with my grandmother. As I said, I was a professional for many years when she developed it. And there were times when I'd have to walk away from her and go, you should know better. You teach this stuff. But all I saw was my grandmother. So never beat yourself up, but give yourself credit, not guilt. That's important. And remember, you're the most important person. If a person is in a care setting or at somebody else's house and you're going to visit, call ahead and see what kind of day they're having. If they're not having a great day, maybe don't visit that day. If you can only visit on weekends because you can't come during the daytime, that's okay. It's okay because you want it to be a better visit for both of you. And when a visit isn't good, while it's heartbreaking for us, the person may not remember why they're upset or agitated, but they can remain feeling that way for hours. So it's not helping anybody. It's not helping you and it's not helping the person. If that helps you justify, then use that because it's a fact. You are a mirror. Whatever you're reflecting, you're going to get back because that person reads us faster than we open our mouth to talk. Know what kind of a day you're having. If you're not having a good day, that's not the time to visit. You don't deserve that. Don't do it to yourself. And only we can make that choice. The person with progressive brain damage has no control. So whatever they may unleash on you, they have no control over. But we can control when we come, when we leave, and what we do. That's the key. Take care of yourself. Do you notice I've got a theme? The best thing you can do for the person with Alzheimer's or related dementia is to stay healthy by caring for your physical, mental, and emotional well-being. That's the only way we can oversee the care of the person, period. By taking care of ourselves. When visits are difficult, try adjusting times, as we said. If leaving is difficult, if the person's in a care setting or at home, have someone else step in. A lot of times that second face can help break it off. So whether it's another family member or friend, or if they're in a care setting, whether it's a staff. But talk it through before, because you want them to step in at the right time. Or time it so that you leave as a meal's beginning, because that's also a natural breakaway. Call in advance to see what kind of day. Never hesitate to ask staff for help. We never give up care. We get teammates. And that's important to know. So never hesitate to say, I need a hand. And again, it's okay not to come for a one-on-one visit. It's okay to come during a meal or an activity, or just before someone's going on and out. That's fine. It's not the frequency or intensity. It's the moment you're here. After difficult visits, make sure you call back. If someone's home, call the caregiver and say, I just need to hear that they're okay. Call the facility if the person was upset or angry when you left. And give it a few hours though, please. Don't call right back or call from the car. But please do call back, because as irrational as it is, we often feel like that person's that way from the moment we leave until we come back again. And you need to hear, she's great, she's having dinner, or she's, watching a movie, or she went to bed. You need to hear that. So please call back. It's normal to feel loss, abandoned, resentment, anger, fear, desperation, and depression. It is normal. And typically it's simultaneous, right? It happens all at once. It's also normal to feel joy, satisfaction, independence, peace, and love. And I always say every moment, which is immeasurable, it's not 60 seconds. Every moment is an opportunity for a moment of joy. And joy can be the littlest thing. It can be a smile. It can be leaving without a fight, right? Find those moments of joy. They're there, I promise. And amazingly, with these diseases, there can be opportunities for completely different relationships than we ever had before. I had a family member in a support group once who, after her mother passed away, she had never had a good relationship with her mother. She solely visited out of obligation because it was never good. But she said, this disease taught me how to love my mother because her mother didn't remember them. And so it became a whole new relationship that she then could carry the rest of her life instead of what it was. So there are opportunities, believe it or not. 10 ways to reduce your stress. Get a diagnosis as early as possible, not for the person you care for. If you don't feel well, call a doctor, because across the board, not just of people with dementia, 60% of caregivers get sick or die for the person they're caring for because they neglect their own needs, their own well-being. So if you don't feel well, call a doctor. Know what resources are available. Talking to organizations like the Alzheimer's Association, and that's, the full name is Alzheimer's and Related Dementia Disorders Association, Inc. So it's not just Alzheimer's specific. Talk to Jen, because it's not about coming to Sunnyside, it's about being a resource for people. Talk to your area office on aging. Also connect with your Alzheimer's Association where you live, because they can also, there's support groups, there's information, but there's things that can help you through this. And it's important to know what resources are there. Become an educated caregiver. Right now, still, education is our greatest tool. We can't stop the disease yet. We are on the cusp. We have our first medicine to help slow it down, but we can't reverse it. We can't prevent it. So there are still a lot of things we can do to maintain people better, longer, and also maintain ourselves. Okay. Get help, take care of yourself. Easier said than done, I know that. But remember, if you don't take care of yourself, how are you going to make sure the person's taken care of? Bottom line, that's very black and white. If you don't take care of yourself, you can't take care of the person. Manage your level of stress. Easier said than done. Accept changes as they occur. And remember, use this term. It's brain damage. As a family, it's hard to remember that, no pun intended, because long-term memory is intact and the guilt button is still very present for the person with progressive brain damage, because that's long-term memory. But it's a disease. The person has no control. Only we can control how we approach it and then what we do for ourselves after. Do legal and financial planning for yourself. I can't tell you how often that someone getting sick prompts us to do their legal financial planning. But many times, especially for spouses, You may be the power of attorney for your spouse, but your spouse with progressive brain damage may be your power of attorney. So it's a good time to review and put things in place so you don't have to worry about it. Be realistic. That's not realistic. Be in the moment. That's my advice. Be in the moment, right? Good moments, bad moments. Ideally, there's no such thing as a good day or bad day. We look for more good moments than bad moments. That's the key. And give yourself credit, not guilt. And that's it. Any other questions or anything we want to talk through? Or
One question, what if you've done everything in 1 year wrong?
first of all, let me say that you've done nothing. There's no wrong or right.
Okay.
There is no wrong or right because she doesn't remember. This is our advantage. If you can find pearls with these diseases, one is that after every interaction, the slate gets wiped clean.
You get a mulligan every time.
You do. That's how I play golf, my hand wedge and my foot wedge. But there's no wrong. There's just different. That's all. Because as bad as an interaction goes, I promise you, she doesn't remember. She gotta let herself off the hook. If you don't, that's what she's reacting to. She won't remember.